Have you ever had that feeling where you take a deep breath, your chest expands, the air goes in, but somehow it doesn't satisfy the urge? Like you're still hungry for oxygen, even though your lungs are full.
Air hunger. It's a terrifying sensation. And for most people, the immediate assumption is something is wrong with my lungs. I need an inhaler. I need oxygen.
Right. You'd assume asthma, maybe pneumonia. But what if you go to the doctor, they run all the tests, pulse ox is 99%, chest x-ray is clear, spirometry is perfect, and they tell you, you're fine. Meanwhile, you're sitting there gasping.
That is the exact reality for a huge number of people living with adrenal insufficiency. There's this massive disconnect between what the patient feels, which is a desperate need for air, and what the standard medical tools can actually measure.
And that disconnect is what we are digging into today. We are looking at a really compelling article from My Adrenal Life titled The Lungs, Breathing, and Adrenal Insufficiency. It basically argues that shortness of breath is one of the most common, yet most dismissed, symptoms of low cortisol. So Rachel, if the lungs are structurally fine, why does it feel like suffocating?
It's a great question because it forces us to rethink what breathing actually is. We tend to think of breathing as just a mechanical bellow system, lungs open, air in, lungs close, air out. But the article points out that breathing is heavily regulated by hormones, specifically cortisol. When you have adrenal insufficiency, whether that's Addison's disease, secondary AI, or steroid-induced, you lack the cortisol necessary to regulate that system efficiently.
Okay, so let's break that down, because when I think of cortisol, I think of the stress hormone. I think of fight or flight, maybe blood sugar regulation. I don't immediately think lung function.
Most people don't, but think about what the fight or flight response actually requires. If you need to run from a tiger, you need your airways to dilate, you need your diaphragm to pump harder, and you need your brain to be hyper alert to oxygen levels. Cortisol helps orchestrate all of that. The National Institute of Diabetes and Digestive and Kidney Diseases explains that cortisol affects metabolism and the immune system, but it also supports vascular responsiveness. When cortisol is low, that orchestration falls apart.
So it's not that the hardware, the lungs, is broken. It's that the software, the hormonal signal telling the lungs how to work, is glitching?
That's a perfect analogy. The article highlights a concept called air hunger versus true oxygen deprivation. This is crucial. In true oxygen deprivation, your blood oxygen levels drop. In air hunger, your oxygen saturation, that little number on the finger clip, can remain perfectly normal, but the sensation of breathlessness is overwhelming.
That sounds almost like a phantom limb pain, but for breathing. If the oxygen is normal, why is the brain screaming danger?
It comes down to carbon dioxide sensitivity and the autonomic nervous system. The article explains that cortisol helps regulate how sensitive our body is to CO2 buildup. If that balance is off because cortisol is low, the brain might misinterpret normal breathing as inadequate. It signals the alarm bells, we need more air, even when the blood gas levels are technically fine.
Which explains why a patient might say, I'm breathing, but it doesn't feel like enough. That's a direct quote from the piece. It's a sensory processing error caused by a hormonal deficit.
Exactly, and there's a muscular component here too. Cortisol supports skeletal muscle strength. The diaphragm, that big muscle under your lungs that actually pulls the air in, is a skeletal muscle. According to research cited by the NIH on respiratory muscle fatigue, when muscles don't get the metabolic support they need, they tire out. Low cortisol can lead to muscle weakness.
So it's literal muscle fatigue, like trying to do a bicep curl with a weight that's too heavy, but it's your diaphragm trying to take a breath?
Yes, if your cortisol is low, say you're due for your next medication dose, or you've had a stressful day that burned through your reserves, your diaphragm might just be tired. It's working, but it feels heavy. It feels laborious. That sensation of effort is what the patient perceives as shortness of breath.
I want to circle back to something you mentioned about the autonomic nervous system. This article mentions autonomic dysfunction. Now, that sounds complicated. What does that actually look like for a patient sitting on their couch?
So the autonomic nervous system controls all the stuff you don't think about: heart rate, digestion, and breathing rate. It has two modes: the sympathetic, which is the gas pedal, the stress response, and the parasympathetic, the brake, the rest and digest. Cortisol is the key that keeps these two in balance. The article notes that without enough cortisol, the body can swing wildly between the two.
Like a car with a sticky accelerator.
Right, so you might be sitting on the couch totally relaxed, and suddenly your system swings into sympathetic overdrive. Your heart races, your breathing feels shallow and fast. You haven't moved an inch, but your body is reacting as if you're running a marathon. This instability is why symptoms can be so unpredictable. You could be fine 1 minute and gasping the next.
This really highlights the tragedy of the "your lungs are fine" diagnosis, because technically the doctor is right. The lungs are fine, but the patient is absolutely not fine. It feels like a failure of language between the two parties.
It is, and it's dangerous because if a doctor dismisses it as anxiety, which happens constantly, they miss the underlying cause. If this is happening because of low cortisol, that's a medical red flag. The article stresses that worsening air hunger can be an early warning sign of an adrenal crisis.
Wait, really? So shortness of breath isn't just an annoying symptom, it could be the canary in the coal mine?
Absolutely. Think about it. If your body is under stress, maybe you have a mild infection you don't know about yet, or you're dehydrated, your body demands more cortisol to handle that stress. If you can't produce it, your levels effectively drop. The first sign might not be passing out. It might be this subtle respiratory distress. The diaphragm gets weaker, the air hunger spikes. If you ignore it because you've been told it's just anxiety, you might not updose your medication and you could slide into a full-blown crisis.
That is a critical distinction. Anxiety causes shortness of breath, sure, but in this context, shortness of breath is a physiological signal of low fuel. How does inflammation play into this? Because I know steroids, glucocorticoids, are basically the granddaddy of anti-inflammatories. If you don't have them, what happens to the airways?
That's another layer the article explores. Cortisol is nature's strongest anti-inflammatory. If your levels are chronically too low, you can develop low-grade inflammation throughout the body, including the airways. It's not necessarily asthma, but it's a similar mechanism. The tissues get puffy, irritable, reactive.
So even if you don't have asthma, your lungs might act like they do.
Correct. You might be more sensitive to cold air or perfume or dust. The article mentions that for people with steroid-induced adrenal insufficiency, maybe they were on high-dose prednisone for years for another condition, their bodies are used to massive anti-inflammatory coverage. When they taper down to a replacement dose, even normal levels might feel like a deficit to their lungs, causing that tightness.
It seems like there's a paradox here. We usually think of steroids as something that causes side effects, but here, the lack of steroids is causing the side effect. It flips the script.
It really does. And I want to touch on the diagnostic frustration again because the article brings up a great point about timing. Standard lung tests are snapshots. You go in at 10 a.m. Maybe your cortisol is okay at that moment because you took your morning meds at 8 a.m.
But at 4 p.m., when that dose wears off...
Exactly. At 4 p.m., you might be struggling to breathe. But the doctor only sees the 10 a.m. data. They don't see the dip. Adrenal insufficiency is a dynamic condition. Hormones fluctuate every hour. A static X-ray or a 5-minute spirometry test cannot capture a dynamic metabolic crash.
So what is the takeaway for the patient listening to this? If they are experiencing this air hunger and their doctor says you're fine, what is the next move? Do they just live with it?
No, the article suggests validation is the first step. Knowing you aren't crazy is huge, but practically it means treating breathing changes as a vital sign. If you notice air hunger creeping in every day at 3 p.m., that's data. It might mean your medication coverage is running out too early. It might mean you need to talk to your endocrinologist about dose timing, not just dose amount.
It shifts the conversation from fix my lungs to fix my cortisol coverage.
Precisely. And recognizing that stress management isn't just about feeling calm. It's about metabolic conservation. If stress burns through your cortisol and low cortisol causes air hunger, then emotional stress literally takes your breath away. Managing that stress becomes a physiological necessity, not just a lifestyle tip.
I think that's such a powerful reframing. We tend to separate mental health and physical health, but in adrenal insufficiency, the line is practically non-existent. Your emotions burn the same fuel your diaphragm uses.
It's all one tank of gas. And I think it's important to mention the safety aspect the article concludes with. While we're saying it's likely cortisol, you can't ignore the other stuff. Pulmonary embolisms happen. heart attacks happen. The advice isn't to ignore chest pain. It's that if the emergency causes are ruled out, don't stop looking. Look at the adrenals.
Right. It's not an either or, it's a what else. If the ER says your heart is fine, go back to your endocrinologist. Don't just go home and suffer.
And share resources like this with your doctor. Many general practitioners and even some pulmonologists aren't deeply trained on the nuances of Addison's disease. They know the textbook crisis symptoms, low blood pressure, bronzing of the skin. They might not know that air hunger is a low cortisol symptom. You have to be your own advocate.
It's a heavy burden, isn't it, to have to educate the people who are supposed to be treating you?
It is, but understanding the mechanism, knowing why you feel this way, is empowering. It takes the fear out of it. Instead of thinking, I'm dying, you can think, I'm low. And that is a solvable problem.
I love that. I'm not dying, I'm low. It turns a catastrophe into a maintenance issue. Before we wrap up, I want to zoom out on the legacy of this kind of symptom dismissal. We see this in so many chronic illnesses, don't we? Where subjective patient experience is overridden by objective data that isn't actually measuring the right thing.
We do. It's the gaslighting by metrics phenomenon. Medicine loves what it can measure. We can measure oxygen saturation easily. Measuring intracellular cortisol signaling or diaphragm fatigue in real time, that's hard. So we prioritize the easy measurement and dismiss the complex reality. This article is a pushback against that. It's saying the patient's sensation is data. We just need to learn how to read it.
And for anyone listening who has loved ones with AI, this is a good reminder. If they say they can't breathe, don't just tell them to just calm down. They might literally be running on empty.
Exactly. Ask them if they've taken their meds. Ask them if they need water or salt. Treat it as a biological need, not a psychological flare-up.
This has been such an eye-opening look at a symptom I think most of us would never associate with adrenal issues. It really shows how interconnected our systems are. You can't just isolate the lungs from the hormones. Rachel, thank you for walking us through the physiology here.
My pleasure. It's a complex topic, but understanding it can literally change how people manage their day-to-day lives.